The cases of infertility seem to be rising nowadays quite a lot.
Definitely varies between male and female. Delayed marriage and planning for children, diabetes, obesity. Indian population's thyroid disorders are very common. Endometriosis, with PCOD being one of the leading causes.
What are the most common medical reasons which causes a man infertile?
We have hormonal disturbances. We have varicocele, we have lifestyle disorders. We see that these men, ones who smoke, not only have a problem in sperm production, will probably have some sort of, erectile dysfunction or a premature ejaculation, working in hot environment and using tight garments.
Fertility in 20s, fertility in 30s and fertility in 40s. How would you explain that? Today, I am joined by Dr. Ishita Pal, a distinguished obstetrician with a special interest in gynecologic oncology. She also serves as an assistant professor at Mumbai's foremost maternity hospital and is widely respected for her clinical expertise and academic contribution to women's healthcare. Let's talk about infertility with compassion. Let's ask the doctor. Indian families में अगर हम देखें, आज शादी हुई है, within a few months एक सवाल रिलेटिव से, माँ बाप से, दादी से, दादा से, सबसे चालू हो जाता है, when are you giving us good news? बच्चा कब कर रहे हो?
Yes. Actually, that has been the norm since I think generations. People have been celebrating their first anniversary with a kid in hand. So that's just expected, Ki within the first 9 months, I need a grandchild. The mother-in-law, the mother, everyone's like, when are you having a child? But actually we're not in the same situation right now. Socially, economically, everyone has their own aspirations and priorities. So obviously things have changed, but that pressure still continues, which is the main reason for a lot of stress that goes on with young married couples.
In fact, in today's time, we think that couples are definitely delaying pregnancy, They are taking a decision with a lot of thought and consideration. Times are no longer the same that it used to be earlier. आज सबकी एक choice हो गई है कि when and when not they want to become pregnant. So doctor, tell me one thing, that the cases of infertility seem to be rising nowadays quite a lot as compared to earlier times. So why is it happening?
When we're talking about causes of infertility definitely varies between male and female. First off the bat, it's always lifestyle, because these days, apart from having delayed marriage and planning for children at a later date, there are other reasons. There are lifestyle issues that are happening, like diabetes, obesity. These are rampant things. These affect not only the hormonal balance in males and females, which will eventually also affect the basic primary biological cycle that is required for a successful conception. Apart from this, the stress that is there in just general work-related, family-related stress, even family pressure, familial pressure for, getting pregnant or having a child earlier, that has an effect. I've seen so many patients who are coming in who are relatively young. They're just 21, 22. They've been married a year. But tell me, why would a 21-year-old or 22-year-old generally have any biochemical issue? For them, I think it is more stress related, where they're not able to, deal with the situation at home or deal with that pressure that has been put upon them. It causes unknown issues with their ovulation. Seemingly everything will come back as normal, and they're still not able to conceive. PCOD being one of the leading causes. It's a spectrum which is underdiagnosed. It's a very big contributory factor towards infertility in women. Thyroid disorders, they really impact the female reproductive system, which is very delicate.
So doctor, you beautifully defined कि it's not just a female or a male infertility. It's actually a couple infertility. When, this is something interesting to know. But of course, both are individuals, both have their respective reproductive organs. So we need to understand what are the most common medical reasons which causes infertility in a woman.
So when we're thinking about female infertility, so the female reproductive organ is very simple, yet very delicate and very it has to be treated with care. So we have the ovaries. Ovaries are where we have all our eggs and ovums. Okay. Girl is born with an exact amount of eggs. Okay, that is there when she's a fetus. So actually when she's in her mother's womb, she already has these eggs which are going to
Limited
be
number
the,
of
yeah,
eggs
so it's
which are
like
going
two
to be used.
generations in one. So she has these limited amount of eggs which throughout the lifetime it ovulates. It's one egg is ovulates per month, and that may or may not end up in a conception. We're talking about ovulation disturbances. Now what is ovulation? Ovulation is that event where one egg or two egg comes out per month, and it is likely to be fertilized or not fertilized, and if it is not fertilized it ends up in a menstrual flow or whatever, the bleeding that we talk about. Now ovulation disturbances are actually very basic to this whole story of infertility. PCOD to suna hi hoga aajkal, it is one of the leading causes.
It's almost like a cough and cold. Every
Yeah,
woman
yeah.
you interact with, every second woman I would say, interact with, they are kind of suffering.
This disease is actually very much linked to lifestyle. I think one of the main reasons for infertility today. So the good news is that it is something that is modifiable, reversible. So PCOS definitely would top the list. Other than that, in Indian populations, thyroid disorders are very common. So another hormone. So we're all playing with all hormones in our body, and the female body, all the hormones have a sort of an interplay going on. So again, if there's a thyroid disorder, that affects our menstrual cycle, it affects our ovulation. So we call it as a non-ovulating hormonal disease. That is, it's not directly related to ovulation, but it is a hormone that is causing a problem, a certain kind of problem with the ovulation. So thyroid disorders. We have a certain number of infections. The female reproductive organ is very delicate. Even a simple infection may cause the tubes and the other regions of the anatomy to sort of suffer, and that interferes with not only the egg coming into the uterus, it also interferes with implantation in the uterine cavity. So these are infections which are transmitted sexually. That is why it is so important. Using a condom or using something that will prevent from these infections from reaching the reproductive tract, that is sort of like preventive towards a later, like a situation where we have infertility at a later date. But not only sexually transmitted infections, we also have tuberculosis, which has a very high burden in the country. They come to us with infertility, we are thinking it can be something else, and it turns out to be tuberculosis. It affects a lot of people. It goes unnoticed till it has done its damage. I think a lot of our viewers would know and already be aware of this complex disease called endometriosis, which is actually, because of advancement in medical sciences, it's being detected faster. A lot of patients would go undetected, undiagnosed for years, almost 10 years, they wouldn't know that I'm actually suffering from endometriosis.
Doctor, since you've mentioned endometriosis, there are a lot of people who would also not know what endometriosis is.
Yes.
So could you just for them explain what exactly endometriosis is?
Yes, definitely. जो हमारा uterus होता है, जहाँ pregnancy आता है, and every month जहाँ से lining shed हो करके it comes out as a menstrual cycle, as a menstrual bleeding. That is the uterine cavity. अभी जो यूट्राइन कैविटी होता है, जैसे दीवारें के ऊपर प्लास्टर होता है, वैसे ही हमारे यूट्राइन कैविटी के अंदर एक लाइनिंग होता है, विच इज़ अ वेरी एक्टिव लाइनिंग. इट हैज़ ग्लैंड्स, इट हैज़ ब्लड वेसल्स, it is impacted by hormones. It's a very versatile lining and it changes continuously. Even एक month में 15 दिन में एक तरीके का होता है और दूसरे 15 दिन में एक तरीके का होता है. These linings, they start occurring other than the uterine cavity. Uterine cavity के बाहर, मतलब यूट्रस के पीछे, आगे, साइड में. It's not supposed to be there, but it is there. When it lands up in these spots, it causes a lot of different issues for a woman. Some women have a lot of pain during menses, they have pain during, urination, during defecation. So, and of course, endometriosis also causes a lot of, organs around to adhere to each other. Now when this happens ना, तो वो पूरा जगह का anatomy बदल जाता है. उसके कारण a lot of women with endometriosis actually find it very difficult to conceive immediately. But everything is finally, it comes down to lifestyle, and our lifestyle currently is definitely heading towards a place where it is causing more disease in the female reproductive tract. So that itself is a very big cause of infertility.
Okay, doctor, this is about women. When we say a man is infertile, what does that mean medically? Like, when do you call a man infertile?
So medically, we generally call males as infertile if they haven't been able to initiate a pregnancy in a woman. When we come to male factors, I think for them, again, sperm and its production is very delicate. Like, I keep on using this term because these things can be affected by even 1 month, 2 months of some insult, and it can really have an effect on male sperm count. There is something called as a varicocele. Varicocele is if there is a dilation of blood vessels in the where the sperms are produced. Okay, so that causes a lot of heat, and the heat always kills the sperm. So we have hormonal disturbances, we have varicoceles, we have lifestyle disorders. Most importantly, we always, like, whenever we see patients, we'll ask them, आपने क्या smoke किया है, आप किसी भी form में tobacco लेते हैं, आपके around, if you're around people who are, if you yourself are not a smoker, but you're around people who smoke, that itself can have an effect because you're passively taking all that chemical into your body. And we see that these men not only have a problem in sperm production, the ones who smoke will probably have some sort of, erectile dysfunction or a premature ejaculation. All these are contributory towards male factor infertility. Working out a lot, working in hot environment and using tight garments, these things really affect the sperm quality of a male.
But these are certain things which will go unnoticed and you will never even think about.
And one more thing that you'll notice is that all of these male factors or some of the female factors that we've talked about, they're all reversible.
Yeah.
The good news is that they're all reversible. A lot of couples, they don't need to feel so heavy on the stress because a lot of these factors can be cured, treatable.
Yeah.
What we're trying to say is infertility is not permanent. It can be treated, it can be reversed. And if the treatment is delayed, that is a different thing. Couples should perhaps get help and get evaluation at an earlier date and not delay it beyond years, because it's very different when you're in your 20s. It's further different in your 30, and we always say that after 35, it's definitely different.
That is one part I really want to touch upon. Like nowadays, especially in modern cities and with the working women, rising. What has happened is marriages are getting delayed and women are definitely, not just women but couple, they are delaying the pregnancy, they are, how is it affecting? Like fertility in 20s, fertility in 30s and fertility in 40s. How would you explain that?
Definitely 20s are the easier decade to get pregnant because you're naturally at your fertility peak. The egg, you also have a good reserve of eggs, so mentally you're not stressed out. I have years ahead of me, my biological clock is not catching up, so the stress factor is low. We're looking at a time where it's relatively easier to get pregnant. Not talking about मतलब जो लोग थोड़ा सा smoke करते हैं, drink करते हैं, definitely वो सब चीज़ affect करता है, but then also 20s is easier. We spent our 20s studying and developing our careers, and it reaches a good level by the time we enter 30s. But in 30s, that it's a little tougher because we always say कि 35 के बाद fertility levels कम हो जाता है. There is a drastic drop because the egg quality goes down. I would like to think of it this way, मैंने जो पूरा अपने 20s और 30s में जो भी अपने body पे मतलब whatever kind of input I have given to my body, that finally has its effect on our reproductive system. So definitely it's easier to get pregnant or easier to try till you're 35. Assisted reproductive technology to come in, IVF जिसको बोलते हैं हम लोग. But definitely not as easy as when you're in your 20s or your early 30s. And the same would carry forward to 40s. Because it's a gradual decline in the egg quality, in the egg quantity that is happening. So hence there's a parallel topic to this about egg freezing. So why do we tell women in their early 30s, if you're planning to have your kids a little later, go for egg freezing, because we know that more after 35 we're looking at a little, you know, tougher times when it comes to quality and quantity both.
वही पुराने ज़माने में जैसे बोलते थे ना, शादी जल्दी कर लेनी चाहिए. So I think it's time to go back to those traditional belief system. They
शादी भी जल्दी करते थे and they would have all their kids in a go, and you would see that no one would ever have any issues.
Yes, correct.
पहले था कि the problem was conceiving too much. People would go for, you know, termination, or they want to end that pregnancy. That would be the problem earlier. But now I think in our common practice we're seeing more couples coming in like we're not being able to conceive. That is even in the younger age group, even in their 20s, even in their 30s. And of course we have patients coming in 10 years, 11 years after their marriage. They've not even gone out to seek help. But suddenly 38, 39 mein they have started, you know, actually getting a constructive treatment for their infertilities.
Doctor, tell me, since you just said that कि there are couples 10 साल तक ट्राई करते हैं और फिर भी डॉक्टर के पास नहीं जाते हैं, तो ये इसका भी एक लिमिट होता होगा कि आपको कब वो पीरियड होता है कि अगर आप नेचुरली ट्राई करके अगर कुछ नहीं हो रहा है, when is the time that you should seek a medical intervention in this situation?
Patients should reach the doctor with their problem within a year of trying. So we're talking about when they're cohabiting, they're living together and they've been trying for a year. They haven't conceived. Go get an evaluation done. If you know that you already have a problem pre-existing, a lot of women have, you know, fibroids, endometriosis, they have a past history of TB, they are known PCOS. So, you know, going for an evaluation earlier is better, because, you know, we know that there is a problem. We shouldn't shy away from it. It's not like if you seek help today and you know, the person gets pregnant the next day. It's not like that. It's an entire process which may take time, and the earlier you go, the better. So 1 year is the mark for if you are less than 35, and for more than 35 we keep it at 6 months.
Sometimes what happens, even after medical evaluation, you just don't know what's happening. You know, so you call this an unexplained infertility.
Yes.
What does that mean?
So basically when we're thinking about infertility, we divide it into male, female, both male, female and unexplained. Okay, these are the 4 major groups. तो male factor हो गया, वो हम लोग बोलते हैं, मतलब male and female का हम देखते हैं common practice में almost equal. Some couples will have only female and some couples will have only male, and these are about 40% each. Okay, and then there's the combined, मतलब both the partners have an issue. We see around 10-15% of that. And then we come to unexplained infertility. That would be around 5 to 10%. So unexplained is sort of like I've done all the tests, I've done all the evaluation, पर मुझे कुछ भी नहीं मिला, सब कुछ अच्छा है. मतलब जब मैंने फीमेल पार्टनर का देखा तो उसका ओव्यूलेशन कुछ प्रॉब्लम नहीं है, ट्यूब्स अच्छा है, यूट्रस अच्छा है, you know, physically there is no issue that's happening. Same with males. उनका सीमेन एनालिसिस किया, सीमेन एनालिसिस में सब कुछ नॉर्मल है, डायबिटीज़ नहीं है, हाइपरटेंशन नहीं है, seemingly healthy people, you know. So for some reason they are not conceiving within a year on their own. So then we call it as an unexplained. We're not able to understand where the problem lies. Everything is normal, but it's just not ending in a conception, in a pregnancy. That is what we call as an unexplained infertility.
So doctor, now after understanding what infertility is all about and how and when the medical intervention is needed if couples are going through it, and what is the best age to increase your chances of becoming parents. Yeah. So we pretty much has understood that. Now there is a certain section we always have in our episode which is called myth versus fact, because you know, sometimes people consider themselves only a bigger doctor than the actual doctor.
And then they delay the actual treatment.
Yeah. So for them we have this section, the certain practices that they have. Tell us whether they are right or they are wrong.
Definitely.
So the number one is, सब reports में normal है, फिर तो problem सिर्फ stress का ही होगा.
But depends, reports किसने देखा है. Right. The doctor has to see and interpret it. So we have a lot of patients who actually come back, they've seen their own reports, they've gone to some person who they consider as a doctor. Reports अच्छा है, but actually some reports में बहुत कुछ है जो interpret करने के लिए you need that person to be around.
और मे बी तुमने सही रिपोर्ट्स ही नहीं कर रहे हैं, मतलब टेस्ट ही सही नहीं कर रहे हैं. You never know.
A lot of times they're like, अच्छा उसका तो सब टेस्ट हुआ है, but the husband has not been tested. The husband has denied testing, or you know, you have a lot of familial pressure कि नहीं उसका तो कुछ नहीं होगा, तुम पहले कर लो. तो रिपोर्ट सब अच्छा है, is a very subjective.
Yeah, you know, this is also very, I would say, a very sad thing. Whenever situations like these arise, women are always considered primarily at fault than a man. मतलब the first thing that anyone would say कि हाँ ये लड़की में ही कुछ प्रॉब्लम होगा, जो कि नहीं होता है वैसा, right? So you are the one who deal with such kind of cases. What are the chances that genuinely women are primarily the reason, or is just both?
See, I think giving birth is a gift that only women have. Definitely it is a huge responsibility, but with it comes a lot of, you know, trauma that comes from the family side, because they consider कि अगर इसको ही pregnant होना है और इसको ही you know, you have to go through the entire pregnancy और इसी को delivery, तो the main issue has to be with her. Why is she not conceiving? They never figure out that ठीक है, to conceive you need an egg and a sperm, and both are being produced in a different body. So it can be either this body or that body that might be affected. So definitely it's the women who have to bear the brunt of this entire thing. They have to not only undergo the evaluation first, they are considered mainly the reason. Even if अगर कुछ reports अच्छा नहीं, मतलब सब reports अच्छा रहे, तभी भी they might be like कि नहीं इसमें ही कुछ problem होगा. You know, the male is not taken into consideration very often and very early. When everything is clarified with this end, then you know they turn to the male partner and कि ठीक है अब इसको evaluate करते हैं. But the actual sense is to do both of these things simultaneously.
और I think इसमें बहुत time निकल जाता है. If both undergo the evaluation together, become more.
If we do something parallelly, then we reach that goal faster, rather than, you know, run a relay where I'm treating the female first and then after I'm done with that I'll go on to the male, and you know it just pushes the whole thing further.
I think it's very important for men to also take the lead and do go for evaluation, consider their health, because they are also someone who are also breadwinner of the family. They are also dealing with multiple stresses. So not necessarily unka reproductive organ is not getting affected.
No, the main concept is it's a couple problem. Males are equally affected. When I said 40% female and 40% males, matlab 1 in 2 couples, matlab it can be that the male is affected primarily. So why not also evaluate them? Even today, where men actually feel like if they get tested and if it comes positive, if some problem is diagnosed, then it comes back as ki that person is not, you know, it's not masculine enough. But it's not like that.
Doctor, there's one thing which is also being heard quite a lot कि आजकल बच्चे इसलिए नहीं हो पा रहे हैं क्योंकि लोगों का लाइफस्टाइल बहुत खराब है. Can you tell me few lifestyle problems? You know, can you list them out?
Yes, and incidentally, it's the same. It's the same for the girl and the boy.
Yes.
So we're talking about being sedentary, not having enough exercise. Now people are more into processed food. They want to go out and eat. You have so many options. You know, every other day you want to eat outside, and you want to, and no matter what, wherever you go, it's not home food and it's not your natural diet. Any kind of processed food will have an effect on the hormone. Packaged food. Now packaged food is what? It's in plastic, right? Now that plastic is, it always enters the food and that enters the body, and that plastic that goes into our body will go and affect the egg and the sperm both. उसके अंदर जो DNA होता है उसको जाकर के it affects microplastics in flesh. We all have read about it and it is affecting people. Diabetes, another thing. Diabetes is something that affects not only the hormonal balance of the body, it affects ovulation in women, it affects sperm formation in males. So these are few lifestyle issues that are having a very huge effect on our fertility.
This is something that I'm getting to hear from a lot of my married friends, that infertility है तो IVF से ही होगा. Is it true?
In this country, we've had a boom of IVF, but there isn't a lot of public awareness about what IVF or what assisted reproductive technology even is. So basically, whenever we see any patient who has come with infertility, we can't directly go to IVF. That is why evaluation is so important. अभी evaluation में क्या निकला reason, उसके according हम treat करेंगे. So a lot of these things are treatable, reversible, may lead to a natural pregnancy naturally. Okay, for some patients
at any age,
at any age, we're talking about even people conceiving naturally at 37, 38. It's not unheard of. Definitely it is tough, but it is not unheard of. IVF comes into the picture when a lot of the first, second, third line of treatment fails. Then we go to IVF because IVF at the end of the day is invasive. हमें जब IVF करना पड़ता है तब हमें फीमेल से अंडे निकालने पड़ते हैं या मेल से स्पर्म लेना पड़ता है. Then again the girl has to go through procedures where the embryo, मतलब जो conception होता है जो lab में होता है, that is placed in the uterus. So it is basically an invasive thing. So I don't think an invasive thing can ever be a first line treatment for anything. First we have one level where we try to reverse whatever is reversible. Diabetes है तो diabetes को क्यों करेंगे, lifestyle problems है, smoking, tobacco intake, substance abuse, all that can be reversed. अगर वो सब करने से conception होता है, good. वो नहीं है तो we have a second line where we can give medicines to control PCOS, to control diabetes. वो नहीं होता है तो third line होता है where we can give medicines to produce or cause eggs to develop. If a girl has PCOS, is not ovulating on time, so we can give medicines ki ovulation ho, tabhi they can naturally conceive on their own. And when none of this works, or we are talking about a lady who has come to us at age 40, time is less, ovary reserve kam hai, eggs are depleted. Yeah, so for them I would say ki हाँ ठीक है, IVF may be an early thing that we would consider. Or maybe a lady has endometriosis and उसका egg reserve कम है, तो मैं बोलूँगी हाँ ठीक है, IVF may be a option. And there are a lot of couples where the lady does not have enough eggs, or the male sperms are so badly affected that they may need to take it from someone else, a donor. So for them IVF is only considered as a first line when it's that extreme. Age is a factor, she or he is too old, egg or sperm has been very severely affected, there are no eggs or the sperm is very few. So for them we say ki theek hai, you can go for IVF. So it depends on who we're talking about. Definitely for a younger couple or someone whose evaluations are not that bad, tests are not that bad, we would never consider or recommend IVF as the first line. We'd go for something which is more simpler, because every treatment has its own side effect as well. So we have to think of the overall.
And I'm sure IVF does have quite a lot, because if you are injecting something to produce eggs, so
yes,
sure
because we're giving hormones. It has its own. It takes its toll on the body.
Yeah. As a woman, I want to understand this. Ki IVF it's something that pretty much put a woman's body under a lot of stress, right? And because it's an extra injection that you're injecting in a woman's body to produce eggs against her body's natural wish somewhere. Does it have a long-term side effects, and do you think people should go for it? As a woman, if you have to answer this question.
Actually, we've painted a very very demonic picture of IVF as it's cruel on the body, but it's a saving grace for a lot of people. It's given a lot of couples who would not even think कि हमें बच्चे होंगे, a ray of hope, एक आशा दी है कि उनके भी बच्चे हो सकते हैं. But definitely the whole process is taxing on the female body. जो हॉर्मोन्स जाता है वो उसका इफ़ेक्ट होता है बॉडी पे, ठीक है. तो अ लॉट ऑफ ये जो IVF प्रेगनेंसीज आते हैं जिनको हम बाद में वी टेक केयर ऑफ देम, विच वी कॉल एज प्रेगनेंसी एंटीनेटल केयर जिसको बोलते हैं. तो उसमें दे कम अप विद अ लॉट ऑफ कॉम्प्लिकेशंस इन देयर प्रेगनेंसी, बिकॉज द बॉडी हैज़ टू एक्सेप्ट a sort of like a pregnancy against its will. So it does have a reaction to it. And any reaction that the body throws up during pregnancy comes off as like, you know, kabhi BP high ho jayega, kabhi sugar high ho jayega. Matlab pregnancy ke within. It has its effect on the heart as well. Because anything, pregnancy is a very heightened event in the body. तो कुछ भी होता है, normally also pregnancy is high risk and it has a lot of effect. Now we're talking about a patient who may be more than 35, who may already have a lot of, you know, medical issues in the body, and we have put a pregnancy is growing, body का जो pregnancy का जो changes होता है, they will be further exaggerated. So there is I mean, IVF pregnancies definitely have a lot of effect on the body. You'll see women come up with high blood pressures during pregnancy, and that keeps on increasing. उनका pregnancy कभी 9 months तक भी नहीं जा पाता है. We have to terminate it earlier because of these complications that are coming up. And there are lots of women who actually develop heart disease, which may be linked to an IVF pregnancy that they've had. After the pregnancy is over, even after that, the effect lingers on. So, बहुत सोच समझ के हमें इसमें घुसना पड़ता है, you know. It has a very sort of 360-degree effect on the female body.
But that's good to know. I mean, like, I hope people watch and kind of, you know, take this call judiciously.
IVF is definitely a boon. It has given a lot of hope to people. But we have to be very careful on whom we do this IVF on. I don't want to just throw a patient under the bus.
Yeah, correct.
Right. I have to think about that patient as a human. At what cost am I giving that person a baby?
You know, it's said no power comes with a responsibility.
Definitely.
You've been given some kind of a power.
Definitely.
But just exercise it with immense amount of responsibility.
Yeah. And it's not only about the doctors exercising about that. There are lots of desperation in I wouldn't say couples who are under a lot of stress because of family, that you have to produce like an offspring, you just have to do it. तो उस चीज में ना वो एकदम अंधे हो जाते हैं. And with all things you have to get it done from some place which is, you know, good, credible, जो तुम्हारे साथ ठीक करेगा. अभी if you go and get it done from any nook and corner, it'll have its own effect. You know, so these things are, it is both sides. I've seen a lot of patients who come up with getting their IVF done from some tertiary center, मतलब एकदम एक village में जाके किधर एक छोटा कोई IVF center होगा, spending lakhs on it, but they do it, and the outcome of those pregnancies are not the same. मतलब there is always a complication which is greater. तो you know, सोच समझ के दोनों साइड को सोच समझ के करना पड़ता है.
Actually, any medical procedure, whether it's cosmetic or it's reproductive or any kind, that needs to be taken care by established
and
places.
A person who
it shouldn't become a business per se.
It can't be a commercial thing. And there also has to be a lot of awareness in the population. I think India में वो awareness नहीं आया अभी तक. They just know कि IVF है तो directly चलो IVF
That's exactly what I hope this.
It's not, IVF is not the answer to everything. You have a level 1, 2, 3 that is there. Once you exhaust that or time is limited, then we go to IVF. It has to be stepwise.
So एक और चीज़ है बोली जाती है कि अगर आप लाइफ में एक बार प्रेग्नेंट हो चुके हो अपने 20s में और मे बी अर्ली 30s में, तो आपको इनफर्टिलिटी होगा ही नहीं.
That's a myth. That's a myth because every pregnancy is a new chapter, or every period of your life is a new chapter. A lot of patients find it tougher to get pregnant a second time. In the same side, I would like to say a lot of patients who found it tougher to get pregnant the first time have it much easier later.
Some women have PCOD. That's okay, they are aware. But there are certain women who always have normal periods. They think if the normal periods are there, everything is okay.
So again, a woman can have PCOD and have normal periods as well. There's this natural concept where we think कि जिसको PCOD है, they have to necessarily have irregular cycles or necessarily have a high BMI or high, who are called overweight. That's not true. So a girl may have PCOS and still have normal cycles. It's not कि मेरा cycles normal है तो मुझ में कुछ problem नहीं है. There are other reasons like एक hormone होता है prolactin. तो prolactin is produced by a gland in the brain.
Yeah.
Okay, it's produced by the pituitary gland.
Pituitary gland.
And it's a very versatile hormone. It helps during pregnancy, but before pregnancy, it will, cause an infertility in a girl. If it is high, it will decrease the ovulation and the girl will have a problem in conception. Okay, so like a lady can have high prolactin, have normal cycles, and if it doesn't get tested, she never knows. And then again we land up with मेरा cycles तो normal है, पर मुझे क्यों, why am I not conceiving? So basically you have to go through the entire process, you have to go through the entire evaluation to understand at which level is the problem really at. It's not always just menstrual. It can be a thyroid disorder, it can be a, like we spoke about prolactin, it can be other things as well. So yeah, just don't go by the menstrual cycle and say ki theek hai chalo. It's sort of like how males are like chalo mera. I think there's no problem with me.
No, it's such a complex body that a solution to any problem can't be simple.
Yeah,
it's a very complex
and
system.
The most important thing is don't be your own doctor.
Yes.
Go to a person who is qualified to understand what's happening with you.
Yeah. लोगों को लगता है अगर एक बार मेडिकल ट्रीटमेंट किसी भी मतलब प्रेगनेंसी का चालू हो गया है तो उसके बाद नॉर्मल प्रेगनेंसी होगा ही नहीं. Once you've started like some kind of a medical treatment to get pregnant, then once you stop it, that means the normal pregnancy cannot happen.
Myth. This is a myth. There are so many patients who actually conceive mid-treatment. And by treatment I mean they're just being evaluated, little things that are being corrected. Suppose she has PCOS, she's not ovulating, and I've given her just a basic supplement, which affects ovulation, मतलब उसका ovulation better कर देगा, उसी cycle में they might conceive. I always tell my patients, enter it with a positive mindset, wait, don't draw conclusions, let your reports come, let's it's a journey that has to be taken, and don't have any mindset that ये है तो ये नहीं है, मेरा हो पाएगा कि नहीं. Just wait. That stress and anxiety of people undergoing this treatment is, I think, the biggest problem that kind of affects conception and them getting pregnant. Not everyone who has PCOS has to go through a procedure to conceive. ऐसा नहीं होता है. So you just have to be optimized at the right time to conceive. At the right time, the egg and the sperm should meet, and the rest is a natural process. We sometimes forget that this is actually the most basic process that is there in our body.
Very interestingly said, we forget that it's a natural process, right? But now, of course, people are resorting to some unnatural processes also, like IVF. और उसके साथ एक चीज़ आई है कि जो बोला जाता है कि जो IVF के बच्चे होते हैं वो बहुत ही अलग होते हैं.
This has to be from the WhatsApp University.
Yeah, so I want you to talk about that a little bit.
So actually that has no basis. Okay, any of these things that come out, I would have to study children who have been born out of IVF for 10, 20, 30 years to come up with such conclusions. Definitely it's not true. It's a myth. Any baby that may be born out of an IVF conception have the same amount of intellect. Whatever their genetic potential is, they will be that, whether they were conceived by IVF or they were conceived naturally. So this has to be a definite myth.
And also once you've decided that you want to have a child, this is in itself is one of the most beautiful thing or a decision that one makes.
Yes.
So might as well make it a very positive journey,
and
rather
it's not a race.
Yeah.
It's not a race that someone's achieved in a year and I haven't been. So it's the comparison that's the biggest evil in this whole system. Okay, मेरे neighbor की उसका तो अभी शादी हो गया और उसको अभी हो गया और मेरा तो इतना time हो गया मेरा अभी तक नहीं हो रहा है. So I think that is one of the biggest stress points, or what I see generally with a lot of our patients, कि मेरी जेठानी का हो गया या मेरी देवरानी का हो गया, and I'm still at this point. So it's not a race. Everyone achieves whatever they have to achieve in that given when the time is right, as we say. So give yourself time, give yourself space, be there for each other, be considerate about each other. It cannot be that you cannot echo what your family is saying to your partner.
So that really affects treatment. So half the treatment actually starts from, you know, your
Mindset.
mental and your
Yeah.
mind.
Yeah.
Because we're talking about hormones and all of it is sourced and produced from there. So, you know, you need to be calm and be positive. I think that itself will make a huge difference.
And that also might reflect in the child that finally come out.
If I'm tuned to a negative emotion, that will continue.
Yeah.
And that will affect the child. But if I'm naturally tuned to a positive attitude, that will be passed down. Everything that has a good ending needs to be started in a good way. And it's all reversible. It's not permanent. Nothing is permanent. Like the good days and bad days both.
Yeah.
So we just need to remember that every day, every time someone's having a bad day, just they need to remember this is not permanent as well. So
Thank you, doctor, for saying this. I mean, like, I think all of the people who are watching it and I myself need to hear it. Yeah.
thank you.
Yeah.
Thank you.
Thank you so much.
Thank you for having me over.
Yeah.